evening, everybody, and welcome. Today's Knowledge on the Go series from the ICCC is on a very interesting topic. It's about cannabis in Canada. And today, to speak on this, we have a very diverse panel and some very established and esteemed panelists. We have Vijay Sappani from ELA Capital, Curren Hola from Stash and Company, Sabrina RamKellawan from Nodi Group, and Omar Yar Khan from Hill and Notel Strategies. We also will have as a moderator today Pramod Goyal, the president of the Indo-Canadian Chamber of Commerce, that also has a fairly deep experience in the cannabis industry. And I will also help out. I'm Vijay Thomas, the vice president at ICCC, and I will help with the audience questions. Having said that, we do want you to ask questions. We will have a whole section on questions from the audience. So please do, those of you watching us on Facebook Live, please send in your comments, your questions in the comment section. So without further ado, we will move on to talking about the ICCC Small Business Assist Program. The ICCC Small Business Assist Program was started by the ICCC during the COVID-19 crisis, and we continue to run it. What this is connecting people that have problems with people that have solutions and that have the knowledge and the expertise in the area. On the ICCC board, as well as within our membership, we have people that have the skills in accounting, in finance, in manufacturing, in HR, IT, and we've brought together a group of volunteers that provide help to small businesses. So if you're a small business wanting help, send us an email to iccc@icconline.org, and one of our volunteers will help you. Now, before we get in, we obviously have a disclaimer. The information provided by the ICCC at this webinar does not constitute legal, tax, or accounting advice, but is designed to provide general information related to business and industry. And again, the views expressed by the panel members are their own personal opinion and do not necessarily reflect the official policy or position of the ICCC. Now, with that out of the way, I'd like to hand it over to my colleague. Let me just get this back here to Vijay Sappani. Over to you, Vijay. We are going to stop the sharing right now, so you can take over. So over to you, Vijay, and we are going to start with the panel discussion.
Thanks, Vijay. Thanks to the smarter Vijay there. We have an amazing panel here, excluding myself, but Omar Khan, Sabrina, and Curren. I'll probably start by introducing myself, and we'll get the panel to introduce themselves, and then we'll go through some questions and discussions. I'm Vijay Sappani. I'm a pharmacist by education, spent 2 decades in pharma, a little bit of time in government, and then I was founder of one of the larger cannabis companies, Ascend, which I left about 2 years back. I'm still a large shareholder. Ever since I've started about 5 cannabis companies globally, moving from a fully vertically integrated licensed producer to brands and European ventures to now in India and New Zealand. And I think my history with the chamber is that I was the founding chair of the Indo-Canada Chamber of Commerce Young Professionals and a former board member. Nice to be back at the chamber with a little bit of gray hair. Sabrina, do you want to go next, please?
Sure. Sabrina RamKellawan, can you hear me?
Yes, we can.
Unmuted, okay. My background by training is a registered nurse with a critical care background. And I've been doing clinical trials, clinical research for 20 years now. And in every area, even including vaccines, which is coming in handy right now, but also cannabis for the last 6 years. And also done a lot of education over the past few years, as well as cannabis education. I actually worked with TerraSend, with Vijay at TerraSend for a couple of years as well. So I got a chance to work as a licensed producer, and also worked with a lot of licensed producers to help them with clinical trials. Everything from pharmacokinetic studies, PTSD, chronic pain, post-concussion. So I got a really great chance to work on a lot of different product development and also clinical trials to support a number of products. And currently I started a new company early this year called No Group, and it's really focused on more helping using the Canadian expertise to help other countries with clinical trials and education. So that's kind of been my focus recently. And I've just finished a 12-week education program at Michener Institute, and it was all geared towards helping healthcare professionals, which is a huge need, to be trained on cannabis so that they can actually be a certified cannabis educator.
Thank you, Sabrina. Curren, do you want to go next, please?
Sure. First, I want to thank ICCC for putting together this event. Pramodji, Vijayji, and Mayankji, thank you for thinking about me. You know, it's kind of nostalgic, like how Vijay said, being back at ICCC. My background with ICCC is a little bit different than Vijay's. My father, Ajit Someshwar, was the president of ICCC from 1991 to 93. And I have a big, my story of ICCC, I remember back in the day, we were starting our first award gala, and I remember being underneath the kitchen table, licking envelopes and going to the post office with my uncle Manoj Pandit and posting these tickets and invites. So I go back quite a few with ICCC, and I'm just very privileged to be here. A little bit about my background by education. I'm a doctor. I studied in the Caribbean at St. George's University and Xavier University in Aruba. I came back to join my family business in IT consulting. I did a small stint with drapery, but I mostly in IT consulting. And how I ended up in cannabis was actually pretty funny. My buddy, I think he's watching this right now, Abhinav, he was sitting next to me at office, and he said, you know what, Karan, this lottery is going on. It's only $75, but it gives us a chance to do business in other sectors and in the cannabis sector. And I said, you know what, no harm, no foul. It's only $75, you know. I put in my $75 ticket. I was actually in Ottawa with my then fiance, who is currently my wife, and hopefully stays that way. And we were sitting there, we were getting ready for dinner, and I got an email from AGCO saying you're invited to do business in cannabis in the retail sector. And I think my heart skipped a beat, and I said, wow, this is the break that I'm looking for in life. And then I said, oh God, I don't know anything about retail. And I think that's how my journey started. And right now, Stash & Co. Is one of the top 3 highest dollar-wise selling retail outlets in Canada, #1 in actual products sold. And we are opening maybe 5 stores by the end of the year. So yeah, that's my story.
Thanks, Curren. And Omar, do you want to go and give your introduction, please? Did we lose Omar? Omar, I think, Omar, you're on a mute. You have to unmute yourself.
Now?
Yes, we can hear you now. Please go ahead.
Can you see me?
I don't think I can see you, but I can hear you.
Yes, we can see you.
Might be better if you can't see me. Okay, so I'm Umar. I'm the National Cannabis Sector Lead at Hill & Knowlton Strategies. So for those of you who have not heard of us, we're actually quite active in India as well. We're the largest public relations and public affairs firm in the world. In Canada, we focus on government relations, so direct government lobbying on issues related to public policy, but also broader public affairs campaigns, which include aspects of media relations, public relations, and government lobbying. And we also do a lot of consumer marketing work. So I came over to Hill & Knowlton towards the end of 2016. Prior to that, Vijay knows this, I was Chief of Staff to Ontario's Minister of Health and Long-Term Care, Dr. Eric Hoskins. I've got a long history working in politics in Canada, mostly at the provincial level through various portfolios. I actually was Chief of Staff to Harinder Thakkar when he was Minister of Government and Consumer Services in Ontario, and he was quite active with the ICCC. But I also spent some time working in Ottawa as the Deputy Chief of Staff to Michael Ignatieff when he was leader of the Federal Liberal Party. So I actually got into cannabis because of Vijay. Vijay was my first cannabis client at Terrace End, where we did a lot of government relations work for them at the federal and provincial level. Also got to work with Sabrina a little bit in that capacity. And about a year ago, I took on the role of our national cannabis sector lead to kind of coordinate our client activity through all of those streams that I just mentioned. And a few files we're working on right now that I think are topical is right now we are working with a coalition of some Ontario licensed cannabis retailers. We were working with them to get them the ability through the pandemic, through the state of emergency in Ontario, to get them the ability to offer curbside pickup and consumer delivery options. And now we're working with that same coalition, both directly to government and through the media, to get the direct to consumer home delivery option made permanent. So Curren, give me a call after. We'd love to sign you up for the coalition.
I'm down. I'll tell you that the curbside pickup and the delivery has really saved our bacon. I'd imagine a lot of us retailers would have gone out of business if we were just shut down for this kind of reason. Thank you for that.
While you're speaking to it, maybe Curren, this is a good time to talk about, during COVID, there's a lot going on. A lot of businesses are closed. A lot of companies are sadly going bankrupt. But one of the things I'm seeing, and we've seen data in March, sales of cannabis has skyrocketed for medical and for adult use purposes. What are you seeing in the retail side? Maybe you can just talk about the retail side of the cannabis industry itself.
Sure. Okay. So yeah, March was gangbusters, I would say, for the first couple of weeks, especially after, I think it was March 13th, our Prime Minister came out and said, this looks serious. We're gonna shut down some travel. We're gonna isolate a little bit. I think at that point everybody was scared. Recreational wise, I think everybody was like, where and how am I gonna get my stuff, right? We had long lines out the door from my store all the way to Parliament Hill, which is about 20 blocks out, right? We noticed that there was no social distancing, so we had to kind of change our approach and make the line have social distancing. We were working more outside the store than inside the store to control stuff. But yeah, that March was a period. And then everybody was told, please go back home and stay isolated for at least 2 weeks. A lot of the businesses wanted to do work from home. So work from home really hurts retailers because there's no real reason for an individual to leave their house anymore other than to go get groceries. I don't have to go to work. I don't have to wander the street, so I'm not going to a retail front. You'd see in April, the numbers slowly trickled down, right? End of March, April, the numbers slowly trickled down. And then we had the 2-week hiatus, Omar, you remember this, where they kind of put us out and said, we're not essential. From being fourth on the list, I think, of being essential, we kind of just left, right? And my accountant jokes with me that he was, I think, 38th on the list, and he still survived, and we didn't survive. So we got to fourth on the list, we were cut off, and then thanks to Omar and all his hard work, we ended up being allowed to do delivery and curbside. And it was also a fact that the hospitals didn't want to see an increase in patients coming to them during such a time where COVID is taking much of the real estate in hospitals. We didn't want people that were dependent on cannabis to have a reaction and come into the hospital either and take up those positions where we needed beds for COVID. So I think Omar did a great job lobbying, and we ended up in a kind of status quo. I would say that what happened was that the delivery service and the online payments, it was kind of shot at us, right? Before, it was not allowed for us to do online payments. and delivery. And 3 days later, it was allowed for us to do online payments and delivery. And I'll proudly say, thanks to my general manager of operations, Joe, I hope he's watching this, right? We got one of the first online payments in Canada going up, all right? And we had the first bicycle delivery service. And now from our Ottawa store, we're delivering all the way to Brockville. So we put a great chain together, and I hope Omar does a good job keeping this, because we've invested a lot of money retail-wise. We've invested a lot of money to get these processes in place, whether it be curbside online pickup, whether it be delivery to the person's house. It'd be a shame if I'd have to let go of those employees and also let go of the programs that we made for our customers. So yeah.
One of the trends I've seen is that we've seen this pretty much everywhere. There's a significant lineups in all the cannabis retails. But also one of the things I've been hearing and seeing, and Sabrina, maybe I can ask you, I coming from farm, and Omar knows this, we've seen this. Initially, you look at cannabis. Why would somebody want to be in cannabis? But once you start seeing the data of how cannabis is actually effective in pain and sleep and anxiety and Crohn's and many of the subjects, and the types of patients we are seeing, one of the most interesting thing I was seeing is that a lot of the seniors who are coming have never consumed cannabis before. Sabrina, you've dealt a lot with patients in the front line with clinics, in the research side. From a medical perspective, what do you generally see? Why do patients come for cannabis? What has your experience been? What is the profile of patients you're normally seeing?
I think, initially when I was in cannabis, it was mostly chronic pain, because I think that's where a lot of physicians were more comfortable. I think that shifted a lot, and I think we're seeing, a lot more patients with anxiety, depression, and starting to even take it for things that are not on the list where there's a lot of data. So I'm even seeing more pediatric that's expanded from just epilepsy. And because there's data on epilepsy and there's a safety profile, I'm seeing autism, I'm seeing palliative care, even sick kids. I was working with them for a bit in discussion, and they were looking at doing kind of more specific data around pediatrics and palliative care, right? So, I'm seeing it, there's much more of a wider use now. And I think that, there's definitely a strong argument with this pandemic in terms of the medical use of cannabis. So if we look at SARS and MERS, one of the biggest outcomes and prevalence that came out of that was insomnia, depression, anxiety, and PTSD. And there was a study done in Wuhan, China, that showed a 7% prevalence average of PTSD, of about 2,000 something people that were affected by coronavirus. And we're starting to see those numbers even higher in healthcare professionals. And we anticipate that might even be higher right now in this pandemic. So when we look at cannabis, and it's already being used for PTSD, and people are already using it for anxiety and depression and things like that, insomnia, I think that, I'm starting to see some clients are looking at doing research in those areas, specifically looking at depression, sleep, and I think that's a good thing. And I don't know if you saw that recently, the University of Lethbridge is actually they actually analyzed 400 strains, Health Canada strains, and found 13 might have a potential. We'll say might, there's no clinical trials. So there is a potential for those to potentially use to see if it could help with COVID, specifically with the anti-inflammatory response that causes that cytokine storm, and possibly be used adjunctly with prednisone and other steroids to help with that inflammatory response. So I think right now is a really key time with there's grants and budgets around COVID-19. I think I'm seeing people are starting to not just look at research specific with COVID-19, but also the mental health areas as well. That's kind of what I'm seeing.
That's a very good point. I think the two things you raised is that, pre-COVID, post-COVID, but also there's a lot of research going on in cannabis, and there is going to be a lot more opportunities coming in the post-COVID world. Omar, maybe this is something I should ask you. You sit in the board of the Medical Cannabis Council, and you've also dealt with a lot of cannabis clients across the board. What, Omar, do you think are some of the job opportunities and, business opportunities in cannabis? We're seeing LPs, retail, research. Most people don't realize, but, cannabis companies need accountants. Cannabis companies need IT professionals. Omar, what is your opinion? I think this, in a post-COVID world, this industry could be growing significantly. A lot of people might be looking for business and job opportunities. Can you give us a little bit of your thought on this, Omar?
Yeah, so it's no secret that the cannabis industry, particularly with respect to production in Canada, has had a tough year, and it's only been exacerbated by COVID. It's not entirely surprising. We see this in a lot of startup industries. We saw it, we saw it with IT back in the early 2000s. We saw it with mining a few years ago, and we saw it with the automobile industry at the turn of the last century. Where you have a lot of new companies start up. I don't know what the exact number of licensed producers is right now. You probably do, Vijay, but it's close to, right? So is there going to be consolidation in the industry, and particularly on the production side? Probably. Are there going to be some insolvencies? Probably. But we will still have an industry because regardless of some of the growing pains, we do know that if you take the illicit market and the legal market and combine that together, we're looking at an industry of over $8 billion worth in terms of contribution to Canada's GDP of about $8 billion a year, and an industry that currently, on the legal side, anyways, the illicit side we'll ignore that for a second, but on the legal side, the industry right now employs over 9,000 Canadians. To put that into context, that's more than General Motors. And we know how much attention and support General Motors gets from the government. But that's to just give you some context. In terms of where the industry is going, I know you'll want to speak to this as well, Vijay. There remains a large international opportunity with respect to exploring international medical markets. I'll let you explain the significance of EU GMP certification. But TerrAscend was one of the few Canadian producers, one of the few in the world actually, to have that. And what that certification does is it makes it a lot easier to operate within the European Union jurisdictions with respect to medical cannabis. And we know countries like Germany actually include access to medical cannabis within their national pharmacare program. I think the retail sector is going to continue to grow. The one thing I've been critical of, in the public domain with respect to the industry, is a lack of outreach to diverse communities. I think we're starting to see that change, and I think this call and the people on this call are a testament to that. But in terms of jobs, look, I do a lot of government relations lobbying. We have people who are public relations specialists. Pretty much every licensed producer and major retailer have brand specialists on their staff. There's growers. It's really it's really becoming quite a sophisticated industry. And for those who are looking for actual specific job postings, there's a company called Lift & Co., which organizes a number of seminars and conferences for the cannabis industry. And their website actually has a regular posting of open job opportunities within the cannabis space. So it's worth checking out.
No, that's a very good point, Omar. And, what we have generally seen, the growth areas, even though there's consolidation, there's always new jobs created, sales reps, technical people, financial, IT, growers, quality assurance is another growing, and on the retail side.
Regulatory.
Absolutely. And to your point, look, I started TerrAscend in Canada. We've expanded, grown into Europe. I've just started a company in India, cannabis company in India. I'm becoming the true ganja dealer in India now. And we've started.
Bang Pani, right?
Yeah, it's bang. And then New Zealand. So the opportunities are definitely there. The biggest point is that I think Canada is seen as a global leader. The knowledge we take from here. When I was starting a company in New Zealand, it was so amazing that the government in New Zealand wants to spend more time talking to me because they want to tap into our knowledge. So Canadians are highly respected in those countries, Australia, New Zealand, new markets. I want to talk about two things very quickly. Sabrina, I'll start with you and then I'm going to go to Curren. I've seen a significant uptake in terms of patients using cannabis. A lot of them will say, well, I'm using it recreationally. Then you ask them, why do you use it? They say, well, I need it for sleep. I have a back pain. I want it to relax. So mostly it's medical and wellness. And I do come across a lot of times, nannies and nanas, are always asking, hey, I want this. Can you bring me a stash? I'm like, you don't need a stash. You can go to a doctor and get it. And the biggest challenge is people don't know how to do it. So I wanted, Sabrina, maybe if you can give it in 2 minutes very quickly. If somebody wants to go to a doctor and get a medical prescription, obviously the first thing is to go to their doctor, and assuming that they don't have a doctor or their doctor is not engaging them, how would somebody can talk to a doctor and probably get a prescription if they're qualified for it?
I mean, I think that, I agree, go to your doctor first, because it's good if they're taking care of you holistically, that they're also managing your cannabis. But the reality is a lot of doctors don't know about cannabis or even how to do anything. But there's tons of cannabis clinics, so it's not difficult. I mean, there's a lot of cannabis clinics that do virtual visits, so you can even do it from your home. And then that way, at least you're getting education. They're hopefully have the right information to help gear you towards an appropriate product that fits their condition and how they want to take it. So whether they want to take an oil, they want to take a topical, there's so many different options out there. They want to do a cartridge because they want something that's more fast acting, like for migraine or pain, or they maybe need more than one method, right? Daily oil, and then something above and beyond that, depending on what their conditions are. So I think that it's not difficult. It is much more of a process. You don't just get a quick script and you go to Shoppers, or you kind of can do that now. But it does. There is a little bit of time to get used to. It's like personalized medicine, so it's not like the first time it'll work. There is a process, and there's some titration that has to happen before somebody can find the right product to work for them. But it's definitely worth the journey to try to see, especially that a lot of patients are coming to cannabis clinics or doctors. They want to decrease their opiates. They want to decrease all their antidepressants and other medication. That seems to be a big driver of why people are wanting cannabis. They're kind of moving away from pharmaceutical and wanting kind of more plant medicine, cannabis being one of them.
So I think, also to one thing to add is, to Sabrina's point, go to your family doctor. And if your family doctor is saying no, I would say just go to Google. And one thing I will say is there's a lot of cannabis clinics, but don't pay a fee to any cannabis clinics. There are some which will say you have to pay $100, $200. You don't need to do that. I don't want to promote any cannabis clinic here, but there's quite a few good number of them. There's a lot of doctors who have become professionals. One thing I very quickly realized is, the perception of potheads, right? We think, oh, he's a drug addict, the kind of words we see in media and people use. And even though I've been 2 decades in pharma, it was an eye-opener for me getting into the cannabis industry. The kind of people who use, it's like my mom and my grandmom and my friends and my cousins. And Curren, maybe you can speak to this a little bit. I've seen in a lot of the retail, so I've been to a good number of retail stores across Canada, and the profile is an average Canadian. I've seen a lot of ethnic people, a lot of, Caucasians, if you want to call them, people in suits, people in shorts. We see a very diverse group of people. Curren, in your experience, what kind of clientele are you seeing? And also, are there anything people should know, like, you should be 19 years and above, who can come in, what do they need? Do they need an ID when they come into a retail? If somebody gets excited after seeing this program, if they want to go to a retail store, what should they know about it?
Yeah, so we'll first start with the baby boomers and older. I believed when we opened the store, and I'm still trying to figure out what is the right demographic to market to. But my marketing team is having such a problem because there is no demographic to market to. When Cannabis 2.0 came, I saw an increase of baby boomers and older generation come into the store because the chocolates, because of the gummy bears. They're more, pun intended, more palatable for them, right? And it drove a different line of business than just the flower. But you would be surprised. And I think that's why the Canadian illegal illicit market has done so well in the past, is because the group between 40 and 60 have been using it since they were kids. And we as a society kind of just turned a blind eye to them and said, you know what, they're potheads, they're this, they're that. I remember when I was in high school, I was like, oh, he's a pothead, that guy's a pothead, this guy's a pothead. But they were secretly doing it. And it happened to be 90% of my class, right, at that point in time. But they weren't outward speaking about it because they didn't want you to know, so your school would know, right? It went to that kind of level. So I think now it's being more widely accepted. I'm in a part of Ottawa where you walk to work and you walk out of work, and we're on the way to people's work and home in between. And people just come into the store, pick up what they want, and they leave. So you'll see the demographic is anywhere from the college student to the old couple, the old sweet couple that you think can do no harm and they're baking pies, are coming into the store to try out some stuff. And yes, the pain is one. The pain is one reason. Chronic pain, this and that, sleep. We always tell all of our patrons that we are not medical professionals, so we cannot give advice at all. We can recommend soothing. We can put things in categories like relax, comfort, and so to advise, and that comes from our professional bud tenders that have been in the industry for quite some time, especially from other provinces. We've flown them in. They can recommend on that level, but medical marijuana is much higher grade and really for more chronic pain. But yeah, we have a diverse thing, and then when you're coming into the store, times have changed, right? We're living a COVID era, right? The new COVID era. We have all the precautions to keep our employees safe and the public safe. We've, as Omar has stated, we've got the curbside, we've got the delivery, we've got the in-store. We put hand sanitizer on you, we give you a mask, we give you gloves, we space you 6 feet apart, only 3 people in the store, and we've got plexiglass covering all the cash registers.
Can you quickly talk about what are the requirements now in Ontario? Do they have to be, like 19 years and older? Do they need to bring ID? Can you talk a little bit about that quickly?
So yes, 19 years and older have to bring your ID to the store. Those are the requirements. Every cannabis retail store has cameras governed by the AGCO all over. So everything is very strict, and yeah, you can ask as many questions when you're in the store. The more questions you ask, the better it is. Education is key. On the medical side and also on the recreational side, education is key. We understand that cannabis is still being researched and understood at a more minute level now, but we're trying to provide as much education so the person that has it recreationally can have a good trip rather than having a bad experience. So
right. So if I can summarize all the things we've talked about today, obviously none of this should be taken as medical advice, but one thing I will say is you have to understand how cannabis works. Cannabis, when smoked, has a faster onset compared to edible, where it might take 3-4 hours. I've gone through that myself, where you're having a couple of edibles, nothing happens, you have a couple more, and then you're like completely sloshed off. So always, if you're going to take it for medical purpose, ask your doctor. There are education specialists who will provide you support with that. If you're going to take it for recreational purpose, obviously speak with retail stores like the Curren runs, and there's hundreds of those across Canada. And I think just to summarize everything we've talked so far, and we'll go into questions very soon, Canada seems to be some kind of a recession-proof industry, at least for now. There's a lot of growth opportunities. Obviously, there's a lot of restructuring because of many companies failing, but seems to be an industry where there's a lot of hiring. All kinds of jobs are possible, from IT to cultivation to research. And there's all kinds of companies in this sector, but also understand it is not just the companies, it's also businesses. A lot of these companies are building. There's a lot of requirements for construction people. There's a lot of requirement for accountants. There's a lot of requirement for quality assurance people. A lot of companies are getting into exports. So people who understand export markets are very important. So I think cannabis is one of those growth-oriented industries where there's a lot of jobs, there's a lot of business opportunities in Canada and beyond. And the second thing is, if you are somebody who's looking at it from a medical perspective, talk to your family doctor. If not, Google, find a cannabis clinic, do not pay a fee, talk to a doctor, research, and then be well educated, make your choices. And if you're looking for recreational purposes, go talk to the bud tenders in some of these stores and be educated, and always consume responsibly, whether it's for medical or recreational purposes. It's 5:05.
Can I jump in on the consumer demographics for 30 seconds?
Please do, and then we'll pass it off to Pramod. Thanks, Omar.
So it's very interesting. About 6 months ago, our firm put out a consumer survey to about, I think we had about 1,000 respondents nationwide, and some interesting findings. So among those were that for products that have a psychoactive effect, so products that contain THC, the bulk of the market opportunity that we found for the legal retailers, so Curren, people like Curren, was to bring over consumers from the illicit market over to the legal market. What we found was of those people, of those individuals who hadn't tried cannabis, yet, there wasn't a lot of appetite to try psychoactive products, but there was appetite to try non-psychoactive products based on which had a high concentration of CBD for the purposes of health and wellness. So it's really interesting if you're a retailer or you're looking to get into the retail space to know the consumer you're going after. So if you're going after the guys or women who want to get a bit of a buzz, you're really going after people who have traditionally been illicit market users and trying to win them over. If you're going after new consumers, so people who are new to the cannabis space, you really want to focus on the CBD health and wellness aspect of the products.
Yeah, I see that quite a bit, and I see a lot of people asking more questions about CBD when they walk in, and then gradually going towards the THC. But I do see a lot of people asking me, "Oh, my mother can't sleep. It has a little bit of pain. Is there something CBD related that we can look at?" So yeah, I get a lot of that.
Awesome. I think, look, we'll open up for some question and answers. We'll pass it on to Pramod. We can always come back to these conversations. Pramod, thank you for hosting this. We'll pass it on to you, and we'll go from there.
Thank you, Vijay. A very warm welcome to all of you, and also to all our guests who are logged in and are with us this afternoon to hear on this discussion. And to continue with what you were discussing, Vijay, I mean, I'll ask a specific question to Omar. What I see and what I'm hearing from the market feedback, yes, the sales have been there, though the projected sales for cannabis in Canada have been revised. They are expected to be slightly lower or under than what was initially forecasted for the current year. And as Vijay also was mentioning, there is a lot of restructuring going on within the space. A lot of companies came up. There was a lot of hype when the market was opened up a couple of years back. And since then, things have been highly optimistic, then gradually started to come back. And as we see the market, the valuation of all these companies that kind of mushroomed all of a sudden, like over 200 licensed producers the last year and a half, they've come up and the valuation have suffered. Now banks have not been very aggressive in terms of financing to this sector. So it was all private investment and people who are looking at making some fast money. They're also kind of stepping back. We see the valuations going down. So what do you see from a broader perspective as to where it is heading, and how long would you think that consumer or investor confidence would come back into this specific industry?
Sure. So there was a number of issues that were faced by Canada's licensed producers that I think influenced some of the problems that they've been facing. Can you guys hear me, by the way?
Sure. Yeah, we can.
So first of all, you can look at a number of reports that were out there. Deloitte is one of them, that pegged a certain value to the potential retail or to the potential sales market in Canada. That value was based on their understanding of the size of the illicit market at the time. What has happened is the legal industry, for a number of reasons that I can get into now, had a lot of challenges in terms of moving over those illicit market users to the legal market. So one of the problems was, for example, not enough retail stores. So Ontario, which is by far the largest province in this country, for the first year of legalization, barely had any retail cannabis storefronts at all. And even now, I think there's only about 100 operational and just over 300 licensed, but not yet operational, all of them. To put that into perspective, if you just take LCBO locations across the province, there's about 900. That doesn't include, the Loblaws and other grocery stores that are now allowed to sell beverage alcohol. So one, there was a lot of production had ramped up based on an anticipated market demand, but because there weren't enough points of sale across the country, consumers, if you can't make purchasing easy for them, they're going to go to what they know, or they're going to stick with which was the illicit market. Two, the consumer experience, particularly that which we saw before COVID online in Ontario. I'll just say, I'm sure there's a lot of people here who have worked in the tech space. The consumers today are used to the Amazon online retail experience. And let's just say that the current experience on the Ontario Cannabis Store, which is the government-run monopoly in terms of online sales before the COVID period, I say it's like a 1990s website as opposed to the Amazon experience. So, we haven't been able to, because of government regulations, offer consumers both the in-person or online experience that they've been looking for. Now that's gradually starting to change, and hopefully we will, as Curren mentioned, we are working to, in Ontario at least, get those private online sales and delivery options made permanent. Another problem that the industry has faced is on pricing, right? So if you take a look at the combined federal excise tax across the country, it varies province to province. Alberta is a little bit higher. Ontario's like slightly above average. That also inhibits the legal market's ability to compete on price with the illicit market. And then, I'll also add on to that. There's a number of illegal websites and delivery services that are still, pretty much active out in the open. I counted just in Mississauga, there's about a dozen phone and online delivery services that are operating illegally. And supposedly Mississauga has opted out of legal cannabis sales. But there's about a dozen, we showed this to Bonnie Crombie directly, and she was flabbergasted. There's about a dozen illegal operators online just operating right now. So there hasn't been the level of enforcement per se that would be necessary to drive some of these illegal operators out of business. That's like I've said, that is now starting to change. We are seeing governments realize that if they do, if they are serious about eliminating the illegal market, they have to give the licensed producers and the licensed retailers the tools they need to compete. So, I think that's a lot of what's behind some of the challenges, particularly on the production side over the last year. I'll also say this, there are a lot of people who got into the business that had no business being in business. A lot of VC people jumped in early, and a startup mentality is fine for a while, but it's not necessarily what you want to take your company or your industry from infancy into what I said earlier was an $8 billion industry in Canada and much larger internationally. So I think a lot of the boards of some of these publicly traded companies now have started to realize that and have been making leadership changes.
Right. Thank you, Omar. I think I agree to, I mean, most of the things that you said, and I think it's a big challenge, uh, what we see in the industry, even from a supply chain perspective. Like we talked about, the sheer number itself is so small in Ontario, especially for the retail outlets, and the increased production capacities earlier in anticipation that all these producers had. Now, with coupled with COVID situation, so I'm sure the online platforms that or the delivery module that the government had built in would not be as effective. So, how are you taking care in terms of handling this issue when people can't come into the store? They can only order online and then come in and have curbside delivery, or you have to arrange online. So is the online delivery module still effective? And are you able to manage, or people like you who are operating other stores are able to rely on that system?
I think the challenge in retail is marketing, right? We're not allowed to openly market like like you see clothes stores do. What getting the word across, saying that we are open for delivery, is a little bit challenging, and it was a little bit challenging during COVID, right? When newspapers weren't even coming to your front door, we had to find a way to tell the people in the vicinity and the people of Ottawa and the people of outside all the way to Brockville that we're ready to deliver. The competition has grown, right, and has pushed us to do free delivery and have certain systems in place to entice the customer to use our services. But yes, the delivery system does work and it should remain. The OCS, I'm 100% with Omar on this, where the OCS, their whole supply chain to the consumer is just really messy and made no sense. You would order something, you'd get it 2 weeks later, your packet would be pretty much open, right? And you're paying good dollar, right? Where I can give you the same product in your hands within 20 minutes with a guy delivering it by bike. The delivery model works. The curbside works in this day and age. Just unfortunately because you can't come into the store. But what happens is that it doesn't help us get the new customer. It doesn't let us get the new customer and the people that are using the illicit ways of their delivery system. It doesn't help us get those customers. The customer can't peruse your store anymore, can't learn from a bud tender, can't have that feel and touch. So basically, we are now the delivery arm of like an LCBO for the government, right? We don't have any originality. You can go to me or you can go to someone else. Because you don't come in our store and don't feel our environment, don't feel our personality and what we're trying to portray, you're just getting a product, and that product comes from OCS. So whether you go to the guy next door or you come to me, you end up getting the same product. But now you can't come into our store. So which it really relies on what delivery system and how many minutes it takes me to get the product from my shop to your door, one, right? And how close I am to the vicinity of your house to get a curbside pickup. Slowly now that we're allowed to open the doors for people to come in, they're slowly coming in. But still people are very scared to come out in this COVID environment. They'd rather stay at home. We saw, even in Toronto, we saw a spike. In Ontario, we saw a spike for the weekend, right? It hit the 400 levels, something that hasn't happened really since March. They say it's because of Mother's Day, we'll see. But people are still afraid to come out, and slowly, with the good weather and summertime, and hopefully we can wrap up this COVID nicely, people will come back into the store and there will be a differentiator. But yeah, delivery and curbside is the way we are keeping the store and the lights open.
Sure, thank you. Sabrina, a question for you. You talked about different strains and varieties, and which are good for addressing different issues. And I think based on my understanding, there are hundreds of different strains that are available, and each one of these would be effective in some situation or to treat some medical issue. Uh, Based on your experience and that you know about the industry, so typically the number of products or strains that are available online, or especially we talk about, say, retail outlets, how many do you think are generally available? And if the consumer, say, have a choice, if, say, 10 or 20 or 50 are available, and if they're looking for different streams, if they have learned about from anybody, or when the doctors are making a prescription, are they prescribing on a particular strain, or it's just a generic product?
That's a tough question. So, I mean, just the course that I've done, we kind of try to help doctors and nurses navigate, because there's so many strains. And a lot of it is really, what we do is really base it on research. So we look at what research was done and what they might have used for, say, neurological pain or anxiety. So if we look at anxiety, for example, a doctor might start more of a CBD strain. And also we're even making it more complicated, because now we're looking at terpenes and what those terpenes can do. So if, limonene, for example, is more anti-anxiety, myrcene helps with pain. So we're looking at the whole profile of that cannabis. So looking at its THC CBD ratio and trying to navigate with that patient what might work well. For neurological pain, we're looking at THC and CBD. So it really is, it really varies with each doctor and nurse, because sometimes they're really conservative and they want to really focus them more on CBD and titrate them slowly on THC. That's usually the approach on the medical side. So we can usually start from, like, say, 1.25 milligrams, anywhere from 1.25 to 5, depending on if they're naive, lower. If they have experience, we can go a little higher. And typically we're titrating up between 1.25 and 2.5 every 2 to 3 days and monitoring them closely. And then they come back to the doctor with the diary and the nurse. And then we can see if it's helping with their pain, if it's helping with their, whatever it is that their condition is. So that's kind of how we're navigating it. And it is a process. So it could be that if we give them a CBD dominant strain, it might do nothing for them. And that does happen a lot with neurological pain patients. But I think that we just want to kind of go slow and low as doctors are educated and healthcare providers are educated. And it sometimes takes a month or so before we even get to the right product for them. And usually it's titrating up that THC to get that right balance of, is it working without the unwanted effects? Because from a medical perspective, they want that efficacy, they want that product to work for them and help them with their symptom, but they may not want that euphoric effect, because they have to go to work or they have to take care of their kids. So they're looking for the benefits without that euphoria, without that high.
Sure. Yeah, thanks. One question, I think, Vijay, I'll address it to you. I think you are involved in several projects, and you've been in the industry around here. So now the government's stimulus packages for all the businesses and industries that have been rolled out in the last few months. So any of those incentives or packages that the government has rolled out, has it been effective? If you look at the cannabis industry, where it is the licensed producers or the retail side, has it been effective? I mean, I think there have been only a couple of them, except for specialized financing schemes. The SEBA, which was for the small businesses, and then the wage subsidy, I think, which can be applicable to other people as well. Besides that, they were all specialized financing packages, which, to my understanding, financial institutions are still a little apprehensive in terms of extending credit to a cannabis sector. So what have you seen practically happening in the marketplace? I mean, do you see any traction with any of these rollouts?
So I think traditionally you're right. I think big banks have never come in. Even opening accounts has been hard in the initial days when we were opening. None of the big banks will give us even a bank account. The moment you have a $50 million check, it's a different question. Every bank comes to you. So that has changed a little bit. Some of the licensed producers have also got credit from banks, but that has also stopped because the whole market has crashed. Now, to your point, you're right. I mean, some of the usual government subsidies have been used. There's also other things like, shred grants, research grants have come, but nothing special that, the cannabis industry can claim that it is got. But overall, industry has generally tapped into some of these government funding opportunities that has come across. And also, I think some of these cannabis companies will evolve to be stronger. Back in the day, if you are in a stage of a license, you could raise money. And if you had a license, you could raise unlimited money. All that has changed. They started looking at who's your management. They started looking at then the top line. Now it's all about bottom line. Show me what's your profitability. Show me what's your EBITDA. That's what is distinguishing the winners from those who could potentially be winners, but are not able to raise any more money because their balance sheet is not what investors want to look. And that is why it has changed very quickly. So the winners will usually, in the future, will be those who are focusing on bottom line, those who are focusing on profitability. And I think that is a trend we're already starting to see.
Can we add to that for a second? Can I add to that for a second?
Sure.
In the retail market, right, I'm opening 5 more stores this year. So let me tell you a little bit about this. There's no bank here that's going to give me any kind of money. They will not finance me at all because the inventory is not saleable for them. It's the government inventory. So I have nothing, and the lease is a lease. I don't own the building, right? All these stores. So if you want to come into the retail arena of cannabis, my first question is how much money do you have in your pocket? And it's not to be rude to everybody that is inspired and aspires to be in retail, but think about it numbers wise. You need at least $200,000 to $300,000 to make a store. Then once you get the store up and ready, you need to go out and purchase inventory from OCS. If you don't have inventory, you can't sell anything. So you have to buy at least $300,000 to $400,000 worth of inventory and hold it, and get insurance for OCS of $10 million. Get the landlord insurance, right? Liability insurance. You're looking at a game that is anywhere between $700,000 to $1 million just to open one store. This is the reality. And all the licenses that we see coming out of AGCO right now, going through public notice and all that stuff, I can tell you at least 1/3 are going to fall by the wayside. I've had friends that are so excited that the market is open. They've gone and made stores and put the money in the stores and opened 3 stores, and now are questioning, how much money do I need to buy inventory? Now, when I look at it, I said, boss, if you don't have inventory, you can't make a sale, right? And you're not getting financing. So unless you have money, or like Omar says, you sell your soul to the VC or the private investor, right, and lose portions of your company, especially like Canaccord is right there and waiting for you. If you need help, Canaccord will come in, take 45%, give you the money to grow, but they're going to take their chunk, right? If you're willing to do that game and take on the liability for that, right, go for it. But in retrospect, retail is harder than just opening a small store. You need at least 1,500, 2,000 square feet. You need to have the vault. You need to have the inventory structured in a certain way where it's protected and you can't lose it. You need to have the camera system. You need the IT infrastructure. You need the COVAs of the world for the POS systems. It's not an easy game. It's not an easy game. So unless you have
we hear you, and I think it's good that you mentioned all this, because a lot of people who might be watching would be looking at opportunities, and definitely, I mean, there's no harm in looking at. But again, I mean, I think everybody needs to do a lot of due diligence before they jump into what seems like a rosy picture. But then, of course, there are strings attached always.
It's not a quick money.
Thank you, all of you, and I'll just because I see the time clicking. So I'll request Vijay if he has any questions that are coming in from the people who are associated with us. So at least take them first, and if we still have a few minutes, then we'll talk about something else.
Thanks, Pramodji. So we have a bunch of questions. So this has been quite popular on Facebook. So I'll start with a couple of questions. First question to you, Sabrina, and this is with the title which says COVID-19 and the cannabis sector. The question is, can cannabis cure COVID-19? Is there a cure for that?
That's the big question we're all trying to figure out, right? I mean, it's funny because people make fun that cannabis, that I remember when I saw that posting from the University of Lethbridge, people were like, oh, great, you know, cannabis is trying to act like they can help with COVID-19 and they're trying to get their stocks up. But I mean, isn't that what pharma companies are doing now? We have a pharma company out of Montreal that had a cystic fibrosis study, and they're now pivoting that same product that also is anti-inflammatory and now using it to see if it'll help with COVID. I don't see it any different with cannabis. Does have some anti-inflammatory property, antiviral. If it's going to help COVID, I have no idea. That's why we have clinical trials in place. So we don't know, but there, you know, I know people are very skeptical when they see cannabis, but it's no different than pharma companies pivoting, using their existing products and trying to see if it'll help with, and it's not a reach. It does have anti-inflammatory properties. It does have antiviral. I think that there is a possibility to look at formulating a product specifically to see if it can help symptom-wise, right? I mean, the vaccine is the only thing that's really going to help, and that's going to take years. But in terms of symptoms, I think it's important to start looking at treatments, and if we can decrease that anti-inflammatory effect that causes that respiratory distress, that causes death.
Fantastic. Thanks a lot, Sabrina. So do you know, in your opinion, are they clinical trials happening with cannabis and COVID-19?
There is, I can't say too much. There is a client that I'm helping with now. We're going through, they've got some funding, so we're looking at how they can go ahead and move that forward and looking at costing and stuff like that. And then the other one I did see at University of Lethbridge, it looks like they are trying to move forward with clinical trials. And I also saw something out of Israel. They're also potentially looking. So those are the only few that I've seen so far, but those are the only ones that I know of. You know, when we were talking about kind of funding and stuff related to cannabis, there is a number of funding over the years from CIHR and different grants that go towards research. One of the big issues is, even though these companies, these institutions get granted money to look at cannabis related to, you know, different conditions and things like that, what the biggest problem is that they're having a problem finding GMP product to actually put in their clinical trial. So we're seeing that funds are out there and they're just going away because they can't connect to a GMP product. I think that's a big area that we need. Yeah.
So thanks, Sabrina. So we have a question. This question is for Curren. So Curren, in the US, if you run a store, any of your, any of your costs cannot be shown as an expense. So basically your revenue is your profit, right? So is that the same in Canada as well? What are the CRA regulations around that? So, you know, can you actually show your expenses as expenses?
We can show our expenses as expenses, and that's about it. But I'm pretty sure when they come and check my books and I have expenses that are not related to the store, you know, I get slapped a little bit, right?
Okay. But I understand. But it's not that, you know. But in the US, it's even worse. Like the IRS, you know, since it's illegal, you really can't show. So I don't think that's.
You know, I run a legal business, right? In Canada, in Ontario, right? I'm not illegal at all, and black is black, white is white. You know, it's like every other business that you run, right? There's no difference in running a cannabis retail store. But yeah, that's about it. Yeah.
Thank you. And this question is to Vijay Sappani. Vijay, the question is around India. Now in India, is this recreational use or CBD use? So what is that? You talked about you're doing something in India. So what is it that you're doing in India?
So India, technically, so this, if you look globally, some countries like, you know, Canada has medical and adult use legal. In some states in US, both is legal. Some states only medical is legal. Large part of Europe, Australia, now medical is legal, recreation is not. In India, it's a little bit different. Cannabis has been used in India for generations, and it's also wasn't illegal until 1983. So in India, cannabis is technically legal under the cultural and Ayush, which is Ayurveda. So you will see there's a lot of products in India that is sold under Ayurveda. In India, Sri Lanka, Nepal, most part of the South Asian region, it is cannabis ingredients are quite widely used in Ayurveda products. Now, India does not have a medical cannabis regimen. India also has been fairly strong in enforcement. That being said, a lot of the regions, especially during holy time, it's widely used. There's a lot of movement happening in many states where cannabis, they're asking to decriminalize and legalize. Many states like Uttarakhand, Rajasthan, Himachal, Arunachal, Manipur, now Goa, are opening up cultivation of hemp. It's a little bit different because it has got no THC or low THC. So cultivation of hemp is starting. There's a few cannabis companies in India that are selling under the provision of Ayush. Now, my company, Savikalpa, that's what we're doing. We have licenses under Ayush, and we're able to sell Ayurvedic products, including cannabis infused and non-cannabis infused, both THC and CBD. We see that within the next probably 3 to 5 years, or maybe shorter, India will likely move towards some kind of decriminalization or legalization for medical purposes.
Fantastic. Thanks, Vijay. So last question from the audience, Omar, recreational use versus medicinal use. What is the ratio in Canada right now, and where do you see it heading out? And specifically a side thing, do you think recreational use is going to increase with with COVID-19 and lockdown and people with increase in mental illness? So do you have any pointers around that? Question for Omar.
Go ahead. Yeah, so Vijay and I actually both sit on the board of Medical Cannabis Canada. So Vijay will have an opinion here as well. The Medical Cannabis Canada is the patient advocacy group for medical patients in this country. So look, we have seen since recreational legalization, we have seen some atrophy in terms of the overall medical patient base in this country. I'd say largely because the process for getting a medical cannabis authorization from a physician or a nurse practitioner, as Sabrina mentioned, it's not the easiest because not all doctors and nurse practitioners are educated yet on cannabis. So we have seen some attrition. I think what will be critical to maintaining a viable medical stream will be providing or giving pharmacies the ability to dispense medicinal cannabis. And that's something that Medical Cannabis Canada, our organization, is pushing for. The reason you want to have a separate medical stream is because, and Sabrina and Vijay will want to weigh in on this as well, I'm sure, there are a lot of, if you're using cannabis as medicine, you're probably also using other medications. And there are a lot of there are some instances where cannabis probably shouldn't be used in conjunction with another medication, particularly heart medication. But as with anything, if you're using a product for medicinal purposes, you should speak to a healthcare professional. So it is somewhat concerning that some of the patients in the medical stream have started to drift over to the recreational stream. The other reason for that is that unlike other pharmaceutical or medicinal products, HST also applies to medical cannabis sales, but on top of that, there is also a specific excise tax on medical cannabis sales. So for a lot of these patients, it's cheaper and more convenient to try and access product through the recreational stream.
Thanks, Omar. Vijay, you wanted to quickly add something on that?
No, I think Omar is right. I mean, one of the challenges is that a drug is a drug. Whether you take aspirin or Tylenol, every drug has this potential for side effect. That's why you want to take it with medical advice. Now, cannabis obviously is a narcotic drug. You want to be way more careful. Take it under medical advice for what you're using it, especially those who are taking with other medications. There could be opportunities of contraindications and other side effects. In terms of Omar's point, you're right. One of the challenges we have today in Canada is that a lot of patients want to get off opioids. We've seen opioid addiction is significantly high in North America. Opioid deaths are the largest amount of deaths in North America. One of the important things we've seen is in jurisdictions in Canada and the US where cannabis is legal, opioid overdose death is almost dropped by 50%, which means people who are trying to take opioids, for whether it's for pain, for addiction, or whatever purposes, have been able to move towards cannabis, and that's been a great thing. The challenge we have in Canada is the pricing. We have taxes, and unlike other drugs, it's not covered. Some of it is slowly changing. Shoppers Drug Mart has a program where some of these cannabis products are covered by insurance programs. So it's a slow curve, but whatever I think the data might be, a lot of the medical patients are, the base is growing, but they're struggling because of pricing issues. And once some of those issues are covered, I think we'll see more and more structured medical use than what it is right now.
I think you're
Sabrina,
right.
you want to go quickly? You got 30 seconds.
I was going to say quickly, a lot of the medical patients are going to the OCS and other places because they're not getting that support from their doctor or nurse. And just going through that 12-week program recently, you recognize how much we don't know, or how much health providers don't know, and doctors, about ConMed reactions. And that's why I like your thought about it going to the pharmacy, because I think that's important. Even something as simple as a patient wants to decrease their opiates, understanding you have to also titrate that with cannabis because they could get withdrawal effects. Knowing, not just cardiac meds, warfarin, other CNS drugs, it's not very simple. And I think that we have to look holistically at the patient and everything else they're taking. And that's why I think, the pharmacy, having someone that understands looking at the patient holistically and all the meds they're taking is really, really important when we look to guide patients on cannabis. The pros to medical is potentially the coverage, helping them with sunlight coverage, helping them with veterans coverage, ODSP, some of those areas that we could potentially help with reimbursement, in which they would need to get it through medical channels.
Thanks, Sabrina. We're really out of time. So thank you very much to our panel today. Thank you very much, Vijay Sappani, for the expert, comments, as well as the expert, panels there. Curren, Sabrina, Omar, thank you very much. Thank you, Pramod Goyalji. And thank you to all our audience, everybody out there on Facebook Live. And if anybody has any inquiries about today's webinar, how to become a member of the ICCC, or you need help with the Small Business Assist Program, please write to ICCC@icconline.org. Again, we've got a great talk coming up, a webinar on COVID-19 and the food sector on the 28th of May. That's 2 days from today on Thursday. Stay safe, everybody, and have a good evening. Thank you very much, everybody. Bye.